What is flow cytometry, used for in lymphoma diagnosis? Imagine trying to identify a specific person in a crowded room. That's similar to what doctors do when they use flow cytometry to find cancer cells in lymph nodes or blood. This technique helps doctors see exactly what types of cells are present and whether they are normal or cancerous. When someone has symptoms like swollen lymph nodes, fever, or weight loss, doctors often perform a lymph node biopsy to get a tissue sample. But just looking at the tissue under a microscope isn't always enough. That's where flow cytometry comes in. Flow cytometry works by labeling cells with special fluorescent antibodies. These antibodies stick to specific markers on the surface or inside cells. When the sample is run through a machine, it shines a laser on the cells, and the fluorescent labels glow. The machine then measures the glow on each cell, giving detailed information about what proteins are on or inside the cells. This helps identify if the cells are normal lymphocytes or if they are abnormal lymphoma cells. In cases of non-Hodgkin lymphoma, flow cytometry is particularly helpful. It can detect abnormal B cells or T cells that are characteristic of different lymphoma subtypes. This process is called immunophenotyping, and it helps confirm whether lymphoma is present. It also helps classify the specific type of lymphoma, which is important because different types may need different treatments. Flow cytometry can also tell us how far the disease has spread. It can find lymphoma cells in blood or bone marrow samples, helping doctors understand if the disease is localized or more widespread. This information is crucial for staging the lymphoma and planning the best treatment approach. Another key role of flow cytometry is monitoring how well treatment is working. After therapy begins, it can detect tiny amounts of remaining lymphoma cells, known as minimal residual disease. This helps doctors see if the lymphoma is going into remission or if it might come back soon. Because the technique is fast and can analyze thousands of cells in just seconds, it provides a quick and detailed picture of the disease status. In practice, when lymphoma is suspected, a biopsy is performed to get tissue, and blood or bone marrow samples may also be taken. Flow cytometry is then used on these samples to give a clear, detailed profile of the cells involved. This combined approach, along with other tests, helps ensure an accurate diagnosis and guides treatment decisions. Overall, flow cytometry is a vital tool in diagnosing and managing non-Hodgkin lymphoma. It helps identify malignant cells, classify the lymphoma type, assess how far the disease has spread, and monitor response to treatment. For anyone facing lymphoma, understanding this technology highlights how advanced and precise modern diagnostics have become. Always remember to discuss your diagnosis and treatment options with healthcare professionals who can provide personalized advice based on your unique situation.